Hi, my name is Natalie Franginals, and today I'm going to be talking about COVID and how it affected my family. I know that COVID is a global pandemic that has affected the lives of everyone, and I just wanted to go into depth and speak about how it affected my family specifically. So, how COVID affects the human body. COVID is a disease that enters the respiratory system and it can lead anywhere to mild to be very severe. COVID affects and can affect your upper respiratory tract, which is your nose, throat, and mouth. Symptoms of COVID include fever, chills, cough, shortness of breath, muscle and body aches, fatigue, headache, loss of taste or smell, vomiting, and nausea. How to prevent COVID. There are many ways to prevent COVID, but the top 3 is to clean everything. Clean your house, disinfect your shoes, your hands when you come in from the supermarket, your clothes, put them immediately in the washing machine. You should clean your hands often as soon as you come back from wherever you are. Clean your hands with antibacterial or soap and lather for at least 20 seconds. Avoid close contact with anyone that is sick or anyone that you do not know personally. And cover your face, your nose, and your mouth with a face mask. How to wear your face masks and the types of face masks that there are. So you can use surgical masks, cloth masks, but when you do use cloth masks, you should wash them every time. After one use, put them in the washing machine. An N95 mask, which is the most preferred mask, and a face shield. How COVID affected my dad. When my dad came back from a trip, he was feeling the early symptoms of COVID, and he decided to wait a week to see if they would go away. After a week passed, he realized that his symptoms were growing and they were getting more uncomfortable, so he decided to go get tested. After getting tested, we waited a week, and on July 7th, we found out that he was positive. My mom freaked out because she had been in close contact with my dad. She had been sleeping in the same bed as him. We weren't social distancing, and she was worried that all of us had the disease. How COVID affected my mom. My mom is very high risk. She has diabetes, asthma, and anxiety. So when she first found out that my dad was positive, she worried for herself mostly because she had been in contact with my grandparents, and my grandparents are very high risk. So we were worried that all of them were gonna get it and probably not make it out okay. Luckily, the rest of us, my siblings and I, and my mother came back negative. So my dad stayed upstairs, and he decided to wait out the rest of his quarantine in the room, and we would bring him clothes, food, anything that he needed. It got worse before it got better. So after 2 weeks of my dad having COVID, he started to live life normally. He would go outside, go for walks, go in the pool, go running, and secretly, he wasn't telling us, but he started to feel worse. He wasn't getting any better. He would go downstairs to get a cup of water with ice, and he was out of breath and he felt like he was gonna pass out. After experiencing this for the second time, he decided to go to the hospital. So when he got there, they took his blood and had him sit outside in a white tent for about 3 hours because they didn't have a room ready for him. After, when they were able to get him a room, they told him that he had pneumonia in both of his lungs. While he was there, he spoke to me and he told me how he can hear the other patients in other rooms gasping, breathing for air, and how horrible it was to hear them not being able to breathe properly. But after the 2 weeks of staying in the hospital, his pneumonia had gone away and he had been taking antibiotics, so he was ready to come home. COVID vaccines. Although there are no vaccines yet out, my father does plan on donating his plasma to help others out, and I hope that they can find a cure for this soon so everyone can get back to normal. Thank you.